Did you know that incorporating just 30 minutes of exercise into your daily routine can reduce your risk of stroke by up to 27%? It's true. As we all know, taking care of our health is one of the most important things we can do in life. And one crucial aspect of maintaining good health is preventing strokes. A stroke occurs when the blood supply to the brain is interrupted, causing damage to the brain tissue and potentially leading to serious health complications. But the good news is that there are many ways to reduce our risk of stroke, and exercise is one of the most effective ones. One of the main reasons exercise is so important for stroke prevention is that it helps to reduce our risk of developing high blood pressure, which is a major risk factor for stroke. Exercise also improves our overall cardiovascular health, lowering our risk of heart disease and other conditions that can increase our risk of stroke. And the best part is that incorporating exercise into our daily routine can be easy and enjoyable, if we know the right ways to do it. Incorporating physical activity into our daily routine can have a significant impact on our overall health and well-being. Not only does it help to prevent strokes, but it also reduces our risk of developing other chronic diseases, such as diabetes and heart disease. And it's not just about the physical benefits, exercise has also been shown to have a positive impact on our mental health and well-being, reducing stress and anxiety and improving our mood. When it comes to stroke prevention, exercise is definitely one of the most important tools in our toolkit. By incorporating physical activity into our daily routine, we can significantly reduce our risk of stroke and improve our overall health and well-being. So what exactly is a stroke? A stroke occurs when the blood supply to the brain is interrupted, either because of a blockage or a bleed. When this happens, the brain tissue is damaged, leading to a range of potential symptoms, including numbness or weakness in the face or limbs, difficulty speaking or understanding speech, and difficulty seeing or walking. There are several different types of stroke, including ischemic strokes, which are caused by blockages in the blood vessels, and hemorrhagic strokes, which are caused by bleeding in the brain. The symptoms of a stroke can vary depending on the location and severity of the damage, but the effects can be devastating. One of the most important things to know about stroke is that it's often a preventable condition. By making healthy lifestyle choices, including regular exercise, a healthy diet, and not smoking, we can significantly reduce our risk of stroke. And if we do experience a stroke, the sooner we get medical attention, the better our chances of making a full recovery. Exercise plays a critical role in stroke prevention, and it's not just about the type of exercise we do, but also how regularly we do it. Aim to incorporate physical activity into our daily routine, such as taking a 30-minute walk during our lunch break, or doing a few laps around the block after dinner. One of the most effective exercises for stroke prevention is brisk walking. This is because it gets our heart rate up and improves our cardiovascular health, while also being easy on the joints. And the best part is that we don't need any special equipment or training to get started, just put on a pair of comfortable shoes and hit the pavement. Another great exercise for stroke prevention is swimming. This is because it's a low-impact activity that's easy on the joints, while also providing a great workout for our cardiovascular system. Plus, it's a great way to relax and reduce stress, which is also important for our overall health and well-being. Cycling is another excellent exercise for stroke prevention. Whether we do it on a stationary bike at home or take a spin class at the gym, cycling is a great way to get our heart rate up and improve our cardiovascular health. And the best part is that it's a low-impact activity, so it's easy on the joints. Dancing is a fun and effective way to get some exercise and reduce our risk of stroke. Whether we take a dance class at the gym or simply put on some music at home and get moving, dancing is a great way to get our heart rate up and improve our cardiovascular health. Yoga is another great exercise for stroke prevention. Not only does it help to improve our flexibility and balance, but it also helps to reduce stress and anxiety, which are both important for our overall health and well-being. High-intensity interval training, or HIIT, is a type of exercise that involves short bursts of intense physical activity followed by brief periods of rest. This type of exercise has been shown to be particularly effective for improving cardiovascular health and reducing the risk of stroke. Resistance training is another important type of exercise for stroke prevention. This involves using weights or resistance bands to build muscle and improve overall strength, which is important for our overall health and well-being. Stretching exercises are also important for stroke prevention, as they help to improve our flexibility and range of motion. Whether we do some simple stretches at home or take a yoga or Pilates class, incorporating stretching into our daily routine can make a big difference. Incorporating strength training exercises into our routine can also help to reduce our risk of stroke. This is because strong muscles help to improve our overall cardiovascular health, reducing our risk of heart disease and other conditions that can increase our risk of stroke. Exercise doesn't have to be boring or time-consuming. In fact, there are many fun and creative ways to incorporate physical activity into our daily routine, such as playing sports, gardening, or simply taking the stairs instead of the elevator. One common misconception about exercise and stroke prevention is that we need to be super athletic or have a lot of time to devote to working out. But the truth is that even small amounts of physical activity can make a big difference in our risk of stroke. Another common misconception is that exercise is only for young people. But the truth is that exercise is beneficial for people of all ages, and it's never too late to start. One of the biggest barriers to incorporating exercise into our daily routine is lack of motivation. But the truth is that exercise can be enjoyable and rewarding, especially if we find activities that we love. Another barrier to exercise is lack of access to resources or facilities. But the truth is that we don't need a lot of equipment or special training to get started with exercise. We can simply start with bodyweight exercises or take a walk around the block. So how can we overcome these barriers and make exercise a habit? One strategy is to start small, setting achievable goals and gradually increasing our physical activity over time. Another strategy is to find an exercise buddy or accountability partner, someone who can support and motivate us to stick to our exercise routine. We can also find online resources and tutorials that provide guidance and support for getting started with exercise, such as fitness apps or YouTube workout videos. Incorporating exercise into our daily routine can be challenging, but it's definitely worth it. By making physical activity a priority, we can significantly reduce our risk of stroke and improve our overall health and well-being. So what are the key takeaways from today's video? First, exercise is a powerful tool for stroke prevention, reducing our risk by up to 27%. Second, there are many different types of exercise that can be beneficial for stroke prevention, from brisk walking to swimming to yoga. And finally, incorporating exercise into our daily routine doesn't have to be difficult or time-consuming. We can start small and gradually increase our physical activity over time. In conclusion, incorporating exercise into our daily routine is one of the most effective ways to reduce our risk of stroke and improve our overall health and well-being. So let's make a commitment to prioritize physical activity in our daily lives and take control of our health. Thanks for watching, and don't forget to like and subscribe for more videos on healthy living and exercise routines. If you have any personal experiences or tips for staying motivated to exercise, please share them in the comments section below. And if you want to learn more about stroke prevention, be sure to check out our other videos on the topic. Take care, and we'll see you in the next video.